Do you do FDL upper back lift and vaso liposuction? What's the difference between vaso and normal liposuction? So FDL is fleur-de-lis, which is a type of tummy tuck where you have a vertical extension. So it's like a fleur-de-lis, like these people have on their shields. So yes, we do that. Upper back lift. Often I'd use liposuction rather than do a lift of the upper back, but yeah, we can do an upper back lift, but we'd have to have a look at that. An upper back lift will give you scars on your rib cage, and I would probably go liposuction there. But anyway, vaso, no. Vaso, we do power assisted liposuction, or liposuction basically is putting a metal tube underneath the skin and sucking the fat out. Basically, that's what liposuction is. And there are assisted forms of liposuction, so it can be assisted in some way. The most common one we use is power assisted, where the metal tube goes backwards and forwards. There are other types of assisted liposuction where energy is delivered to the fat before it is removed, and vaso is one of those. So vaso is one where it delivers ultrasound energy to the fat before it's removed. The benefits of that are that the fat is slightly liquefied before it's removed, so you can use a smaller cannula than you would for power-assisted liposuction. You can often do it when you're awake, whereas a normal liposuction you normally need to be asleep. And the other benefit is because it delivers some energy to the fat, it might deliver some energy to the skin and cause some skin retraction. Now, the people who do vaso would, I think, say that. Now, I don't do vaso, so it's probably best to talk to a vaso person to get a balanced opinion on that, which is good for the skin retraction. So I often say to people, having a tummy of things like that, it's good that if it does cause skin retraction, it's good. Now, the worry is, it's like anything, whenever someone tells you something that's the best or that's good, you say, why doesn't everyone do it that way? Well, if it is delivering a heat energy to the skin, the worry is that I would worry that it can damage the skin. And certainly in the old days, and it might be going back a bit, and I might be old-fashioned saying this, but there was some cases with burning of the skin caused by that energy. And I think now they have temperature probes and things and safety measures to avoid that. But that is a worry for me. And if it is not giving energy to the skin and that much energy to the skin, well, is it going to actually cause that much skin retraction? So it's a balance. They might say, "Oh, no, it's not going to cause skin retraction. It's not going to cause burns to the skin. Of course not. It's not going to give that much heat." Well, then if it's not going to give that much heat, is it going to give enough to cause skin retraction? I don't know. Just saying. It's just Olivia's here. Evening, Olivia. Just saying, I'm not sure whether that how much skin retraction it gives, but that is the difference. And I think you can do a lot of things with power assisted liposuction and vaso liposuction. I'm not sure how much of a benefit it gives, and it's probably a question of looking at someone who does vaso to see whether there is significant benefits with it. But it's not something we do at the clinic.